Welcome back to the Sensitivity Doctors. Today we had a really awesome conversation with Dr. David Rosmarin, who you know personally through your journey of
Yeah.
overcoming panic disorder.
Yeah, such a fun conversation. And I'm so glad I met him. And I mean, if our listeners know about me and my journey and how I'm always saying life happens, it's really such a kind of ode to that way of thinking about an anxiety disorder. He is the author of the book Thriving with Anxiety. He also runs the Center for Anxiety with branches in Massachusetts and New York. He has these incredible videos speaking about overdiagnosis and the changes in diagnosing anxiety online. You should really check that out. So he's just such a wealth of knowledge and a breath of fresh air, I think, in this conversation.
I totally agree. And I will say, as a clinician, it was really fun having him on because I think he and I kind of went down our overly excited therapist rabbit hole a couple times, and you had to rein us in. But it was just like really interesting conversations that were even just coming from the original topic, which was so
Yeah.
fun, which is why I definitely want to have him back.
Yeah, and I think we really covered it a lot from both the clinician and the patient's perspective. So
Hmm.
you'll definitely get a very well-rounded idea of anxiety disorders, and how to seek help. So we hope you enjoyed this episode. Welcome to the Sensitivity Doctors Podcast. Here we explore everything from overcoming anxiety to living in a world not always designed for our sensitive wiring. Whether it's navigating business, parenthood, overcoming trauma, or getting what you want out of your relationships, we invite you to this empowering journey of self-compassion and growth. Sit back, relax, and here are your hosts. So, welcome to this episode of the Sensitivity Doctors. I am very excited to have Dr. David Rosmarin here today because we're talking about something very dear and near and close to my heart. You know, we talk a lot about highly sensitive people on this podcast, and you also know my journey with panic disorder and the struggles that have come with that. I actually met you, I think, through a social media post that you did. And we reached out to each other and we had a conversation, which I really appreciated. And it was one of the videos that you posted on the changes coming into the DSM and how anxiety is being diagnosed, and basically how I took it, how we are almost overdiagnosing it to a certain degree because we're just not dealing with our uncomfortable emotions anymore. So, just to get our audience on the same page, can you tell us a little bit more about what is the DSM and what is this change that has been made in terms of diagnosing anxiety or anxiety disorders?
Sure. First, great to be on the show. Nice to see you again and to have this
Yes. And nice to
conversation.
meet you. I have
Yeah,
Yeah.
not met you
Dr.
before.
Kelley, super nice to meet you. Heard great things about you. So first, I do want to clarify, there are two types of anxiety. There are clinical anxiety disorders that interfere with a person's life, and then there is regular anxiety that every human being has. Okay. Now,
Mhm.
the Diagnostic and Statistical Manual of Mental Disorders, the DSM, as you put it, is the American Psychiatric Association's Bible, if you will, of mental disorders. It describes, categorizes every single disorder that people can have.
Mhm.
It's a very important tool because it says, like, this is depression, this is panic disorder, this is social anxiety disorder. So as a clinician like myself, like Dr. Kelley, like you as well, we need these tools to be able to, when someone comes in, how severe is it, what's going on, to characterize it, to be able to speak with colleagues and with our patients, clients about this. However, there's been a shift. The shift is, I believe, as follows. The Diagnostic and Statistical Manual, DSM, says that in order for something to be a disorder, it has to cause significant distress or
Mm.
impairment.
Mhm.
Anxiety is always distressing. No one likes to feel clammy
Yeah.
hands, the pit in your stomach, it's never going to be fun, ever. But the significant distress is really the key there. And I think we've gotten away from that, such that even low levels of anxiety today are enough to warrant diagnosis and treatment. And last
Mm.
summer, that's what happened in doctors' offices across the United States with a national panel funded by the US government, which made a recommendation that individuals who report anything more than a 0 level of anxiety or worry in the last 2 weeks should be flagged for diagnosis and treatment. Now, can I
Whoa.
ask you, have you had 0 anxiety or worry in the last 2 weeks? You know
No.
anyone who has?
Daily.
No.
Great. We are conflating clinical anxiety disorders with normal anxiety that we all experience. And in doing so, by medicalizing a heart palpitation, difficulties, I'm not saying people don't have clinical anxiety disorders. Believe me, they do. But the vast majority of human beings are going to have, everyone's going to have regular anxiety. And when we start to diagnose
Mhm.
those very low levels, I believe it's iatrogenic. We actually don't recognize it more. We create anxiety into something to fear because now it's a disorder every time your heart goes
Mm.
into
Mhm.
overdrive. So that's the general trend that I see happening in our society, and frankly, it's a little anxiety provoking. It's a little worrisome.
Yeah. And what
Mhm.
is the kind of practical effects of that? Because just one of the things that I'm thinking of is, are these people being medicated? Are they being put on medication to treat this anxiety disorder then that they have been diagnosed with?
Yeah, amazingly, just benzodiazepines, which is a class of anti-anxiety medication, just this one class of medication, just benzos, Klonopin, um, Valium, um, uh, these are Xanax, of course.
Hmm.
There are over 100 million prescriptions per year, which are dispensed by American pharmacies. It's a
Whoa.
very
Hmm.
high number.
Mhm. That's like a
That's
third of our
that's
population.
Yeah,
shocking.
and that's just we're not talking SSRIs, like not Celexa, not
Right.
Zoloft, not no tricyclics, no nothing, not even beta blockers, which are often used for anxiety. We're just talking about benzos.
Well, and it seems if you're using things like this to mitigate anxiety, no one is learning how to actually cope with anxiety.
Yeah, responsible pharmacology to me takes your anxiety down from a 7 or an 8 or a 9, which is definitely clinical, into a
Mhm.
4 or a 5, and then you get the skills to be able to manage it. But if your goal is to
Hmm.
get it
Mhm.
to a 0 or a 1 or a 2, you're going to lose the game. It's
Mm.
not going to work.
Mhm.
You're going to end up having more pumping more pharmacology into the society, and we've become
Mhm.
allergic to this normal human emotion that every person experiences.
Mm.
Mm. I love how you put that.
And it's, when I look at it, my biggest fear always is when I look at the youth of today, because it feels to me like they really are so anxious. But to me, if I look at it from my perspective and how I see it, this is many times because we no longer teach our children how to deal with uncomfortable emotions.
Correct.
Like, nobody wants to feel stressed, nobody wants to feel frustrated or jealous or angry. It's not a nice emotion to have, but stress does not automatically equate to panic. Sadness doesn't automatically equate to depression. Like, again, I'm not taking away from the fact that these conditions do exist. I'm
Right.
just saying that it feels to me like there is, especially amongst the youth, this drive towards, okay, you're feeling sad or you're feeling stressed, let's medicate it or let's do something about it that's way above the level of how we should be treating it in that moment.
I fully agree. I'm interested to hear Dr. Kelly's work. I know you work with
Yeah.
kids and adolescents a lot, so
So, in the beginning of my career, I worked with kids and adolescents a lot. I actually have shifted more towards adults just in trauma work and things like
right.
that. However, I've worked with plenty of young adults who were over medicated
Yep.
as children. And I think a couple things happen. There is a stagnation in development in a lot of these individuals with the coping
Mm.
mechanisms. There's as you're saying, I love how you said allergic. That's a great way of putting it. Allergic to the feeling of anxiety.
Mm.
Um, when I think about what I really try to champion with my clients is learning how to be in a feeling, not fear the feeling, not run from the feeling, but be curious about it. Approach these things as pieces of information about our full experience. And by overly diagnosing, like you're saying, and also it feels too dramatic, like a light switch, like either you are or you
Mm.
are not, but maybe it is a bit more of a spectrum.
Very much so.
Maybe, right. And so I'm curious on your end, how do you How do you personally diagnose and or decide that someone has crossed over from healthy anxiety, which I would love if we could talk about the benefits of
Sure.
anxiety too, because I know we're saying no one wants to feel sad, no one wants to feel, anxious, but I have to be honest, sometimes I'm kind of appreciative of
Mm-hmm.
my sadness or my anxiety or my anger because it gives me insight, it gives me ideas, it keeps me creative, it keeps me connected to what I want, it lets me know what's bothering me.
Mm-hmm.
So, how do we transition from this is healthy anxiety to knowing, okay, now we have crossed the threshold into this clinical world?
Yeah, these are great questions. First things first, when anxiety interferes with your life, that's a clinical
Mhm.
anxiety disorder. So if you can't go to work,
Mhm.
if you can't go to school, if you can't go out with friends, if you can't go
Mhm.
on a plane and you need to go on a plane, right? You
Mm-hmm.
can't go in an
Mm.
elevator and you live in Manhattan, you know, these are problems. This is an issue that has to
Mhm.
be dealt with. Now, in
Mhm.
terms of how to deal with whether it's clinical or non-clinical anxiety, it's easier to use non-clinical anxiety as a strength, to use it to connect with
Mhm.
others by being
That's a good point.
vulnerable, leaning into those difficult feelings, expressing them, right? That creates a lot of connection with each other.
Mhm.
By developing resilience, by overcoming it, by sort
Mhm.
of appreciating our lack of control or the limits of our control and allowing that to humble us, to keep our ego in check.
Mhm.
These are things that human beings have been doing for since the dawn of time, is using
Yeah.
difficult emotions in order to become more connected, to become more human, to become just better in so many ways. Now, it's harder to do when you have a clinical anxiety disorder, but I've seen
Right.
patients who were debilitated by their anxiety and they started walking along the path of developing resilience through, for example, exposure therapy, where people face their
Mm.
fears head on.
Mm.
And it's gut
Mhm.
wrenching and it's so hard. I was going to say traumatic, but it's not. It actually is strength building, but
Mhm.
uh, it's very graphically hard for somebody to face their fears
Mhm.
in session with a therapist. It's very vulnerable, very scary. But when they do that, they've gone on in their lives to become much more resilient after treatment. Once we start walking on
Mm.
that path, irrespective of where we are in the clinical versus non, that path, that the process of using it in a constructive way can carry us forward in our
Mhm.
lives.
I like that you brought up exposure therapy because I think it can sound a little scary, but it is so purposeful. I had a very amusing session with a client about 2 weeks ago. We normally meet in person, but she was at her family's mountain house for the week. So we did a virtual session. And she kind of was in a blissed out space. She's in this really relaxing spa. All the things that normally make her feel anxious are not
Yeah.
worrying her. But because she does struggle with clinical anxiety, her mechanism for anxiety was able to find something in that moment to feel clinically impacted
Sure.
by. And suddenly she was overcome by the bugs around her.
Mm.
The bugs were just in her space. She wanted to be able to enjoy being outdoors, but she was so overcome. So I asked her, well, what do you do when a bug crawls on you or touches you? She says, well, I run inside. I just go inside. I get out. I don't want to be out there. And I said, but you love being outdoors. Like that's the whole reason you love being at this place. So her anxiety was, and I like to bring this example up because it doesn't have to cripple us to the point always, I think, where we lose a job or we lose a
100%.
relationship.
Important
It could be
clarification.
where
I
it's
fully agree.
right. It could be where it's crippling you so far as it's taking you away from the things you love. It's preventing you from engaging in things that you love. And so she loves being outdoors. I'm laughing because I hope she listens to this episode. We actually did exposure therapy virtually where I had her bring the computer into the
I love
yard and
it.
she sat down with it. And I had her touch daddy long legs
Yes.
in session.
Yes.
Oh,
And we did mantra work and breath work and it was like a
Great.
whole session just to get her to touch a couple safe spiders. And I think that's something to decipher with exposure therapy. And maybe you could explain that to our
Sure.
listeners a little bit, that exposure therapy doesn't include doing something that's actually dangerous.
yeah.
Yeah. happy to riff on exposure therapy for a bit. Firstly, this is the gold standard for dealing
Yeah.
with anxiety disorders, clinical anxiety disorders,
Mhm.
and it involves facing one's fears head on. So if you're afraid of
Mhm.
public speaking, you're getting up in front of a group. Now, it might
Mm-hmm.
start with just
Mhm.
raising your hand in class or having a small group
Mhm.
discussion or speaking to a stranger, but eventually it could be getting on stage in front of 50 people without having real good plans on what you're going to do. Now, there's a long way
Mhm.
to go, but there is that process. With bugs or spiders, where I would start them watching videos or looking at even
Mhm.
still pictures. Daddy long legs are perfect. They're annoying enough and
Right.
completely safe. But like you
Right.
said, I would never have somebody do something unsafe. And I do everything I ask my patients to do.
Yeah.
Oh, I like
That's my
that.
rule. In my clinic in Center for Anxiety, we never ask our patients to do something that the
Mm-hmm.
clinician wouldn't do themselves.
And I love that you're saying it doesn't have to necessarily be something dangerous because, for example, when I've had a really bad panic attack, the first thing I do is change, right? I stop eating because I'm afraid I'm gonna choke if there's food in my.
Mm.
I stop going outside because I'm afraid to leave the house. I completely isolate. So now I know, and thank goodness I have a very good support system in my husband. Like he'll give me like a day or two after my big event, and then he will go like, okay, it's time, you need to go to the mall
Let's
and
do this.
you need to go alone. You've got your phone. If something happens, I can be there. I can. And I hate it. It is brutal. I am
It is.
shaking. I am crying. I hate every
Mm.
single second of it. But it does get me out of that faster because it shows me that it's okay. I didn't like it,
Right.
but I survived it, you know?
Mhm.
And most recently, I started horseback riding, which was a huge thing
Oh,
for
I didn't know
me.
that.
Good
That's
for you.
cool.
I'm terrified of horses, but
They
it,
can be intimidating.
Yeah,
yeah,
make a
but it
mistake.
was a good thing because horses can hear your heartbeat from so far away. So I have to work really hard to be calm and to ground myself and to not get hurt and to know. So I really believe in this exposure. For me, it has done wonders. And if I have panic attacks, that's always where we go back to. It's like, okay, give it a day or two, and then I gotta get back in there. I've gotta try even though I don't wanna. But it really does
Mm.
help.
I love what you said, by the way, which is that you still feel anxious. It doesn't take the anxiety away, but you're not as afraid of it anymore. And you
Yeah.
realize, oh,
Mhm.
this is an emotion, and the emotion in of itself isn't going to be the end of me. And I
Yeah.
think getting back to our first part of the conversation, we have turned our negative emotions into the enemy that we must eradicate. And the more we fight against them,
Mm.
the more they come
Mm.
back with a vengeance. Like we cannot eradicate our emotions from our lives, our negative emotions. And by the way, the reason is
Mm-mm.
because you need them. They're healthy, they're positive, they serve a
Mm.
function,
Mhm.
as we were saying
Mm.
before.
Mhm.
So you don't want to
Mm.
get rid of
Mhm.
them, but we feel the need to until you embrace them, understand that they're part of you, let go a little, and then it's like, oh, I don't have to have a perfect emotional profile. I'm
Yeah.
human, and that's
Mm.
okay. It's such a freeing concept. I think all psychotherapy, whether it's exposure or not, gets at the core of that. Exposure, I think, kind of gets it faster.
Yeah.
But it's fun.
But I'm interested for us to take the conversation also a little bit further on all the good things that come with
Sure.
anxiety, like you also said, Dr. Kelley. So, can you give us a little bit of a breakdown for that and why it's a good, normal human emotion that we need?
Well, I appreciate the layup because I recently wrote a book on this called Thriving with Anxiety,
I
Nine
love
Skills
it.
to
I loved it.
Anxiety Work for You. And it is really a stepwise approach to turning anxiety into your ally, not your enemy.
Mhm.
Um,
Mm.
we're not going to go through all nine. That's too much time for that. But
Well, feel free.
well, there are three categories. I think anxiety can help us have a better relationship with ourselves. Once we, just like we've been speaking about, understand that anxiety is a part of the human emotional experience,
Mhm.
we can become more self-compassionate and recognize that like we're not going to be even keeled all the time.
Mhm.
And
Mhm.
that's okay. We're not meant to be.
Mhm.
We don't have to perform 100%, feel 100%, be up to everything 100%. We're going to have those fluctuations. And once there's that acceptance and that understanding that like, okay, I'm a human being, I'm going to struggle sometimes, it just, everything else in life becomes so much more like, okay, I'm giving myself permission to
Yeah.
struggle. And that's something that is so sorely missing, especially in youth, as we were saying beforehand. There's also the resilience piece, as we've been speaking about, right? The more you use those, muscles to power through anxiety to the extent that we can, that can really develop our fortitude and our resilience, something also which is sorely missing today. Another skill is our relationships with others. Think about the people who you feel closest to. Usually it's when you've opened up, you've shared your fears. Jeanne, you were saying before about your husband,
Yeah.
who, I can just see by the way your face, you're like, yeah, because you allow yourself to feel anxious, you don't feel judged, you get a couple of days of like, okay, she's having a hard time, and then there's this support and like, what do we have to do, and I'm in this with you. And all of us in our closest relationships need to drop our guard in order to have somebody catch us and to feel connected to them. It's terrifying,
Yeah.
but it's a process of developing love, and anxiety can be turned into that if we lean into it, as long as we have the skills to be able to do that. So I think anxiety is critical for our relationships with others.
Yeah.
There were two things that you just said that I would love if we could develop them a little bit further for our listeners. The first being um, what it sounded like the first point you were talking about was acceptance. And it kind of makes me think of that acceptance and commitment therapy approach and noticing, diffusing from the feeling. I like to use the visual of like going to the movie theater. You see the experience or the worry up on the screen and you're sitting, and I'll have the client visualize like they're sitting with their favorite snack, they're in their body, they notice the temperature of the movie theater, and then the feeling or the anxiety is outside. It's there, they're accepting, they're watching it. They don't have to kind of fully integrate with it. Um, that's one thing. And the other one is resilience. I feel like resilience is an overused and not well understood
Okay.
term. If you don't mind, if you'd be open to maybe describing how resilience is connected to anxiety management, how someone could be more resilient, like how does that look for people?
Sure. When people are facing adversity, when we bravely muster up the courage, lean into it, accept the limits of our control, and continue to walk along a path, even though you're feeling anxious, you're feeling overwhelmed, that cultivates resilience. That is the core of it. It doesn't happen without an internal struggle. Anxiety to me is the core of that struggle. And it's a critical thing to be able to have those experiences and to keep moving forward. I don't think our youth today are getting enough of this basic concept, this basic practice. You know, um, we don't teach kids how to fail forward. We teach them not to fail.
Oh, that's my favorite. I love failing forward. I'm a big failure.
Yeah.
I've failed a lot. I have failed a lot. I've been told no a lot.
Me too. And if you look at
And
the,
it's a
the,
normal
the
part
greatest
of
leaders,
life.
well,
Yeah.
it's also a sign of greatness. If you look at the greatest leaders in history, they've all overcome, many of them anyway, have overcome incredible adversity. Incredible adversity. I saw something amazing the other day that Winston Churchill, who was Prime Minister of England during the Second World War, one of the greatest speakers, public speakers in the history of the world, certainly during the 20th century. Do you know he had a phobia of public speaking early in his career?
Yeah.
Wow.
I read that in his book. That was incredible. That I couldn't believe that.
Once he literally got up in front of the House of Commons and froze for several minutes. He would not. He couldn't speak. He was completely paralyzed with fear.
Oh my
And he
goodness.
said, I'm going to overcome this because my political career hinges on this. I'm not going to let this get in my way. That's resilience. He got up and he practiced and he faced his fear, just like, bench pressing, just like running a marathon, whatever it is. Like, I'm going to face this and I'm going to master it and I'm going to do it. Anxiety is necessary in order to overcome that. It is a great
Right.
gift to building that emotional fortitude, which we need. Everybody needs it in life. And the more you're going to accomplish, the more you need to be able to handle adversity and stress. So that's the way, I
So
hope that answers your question. I think that's the way I
well,
heard
yeah,
it.
I mean, it almost sounds like you're saying if you have anxiety, you actually have the opportunity to become more resilient than people who don't necessarily have anxiety. It's because you are having to overcome these hurdles. And it kind of makes me think of when I speak about survivors of domestic violence or
Sure.
trauma, that those are some of the most resilient people because they have not just overcome, but they have, done the hard task of facing those situations, leaving those situations. One thing that I do want to make sure that we don't miss about resilience, though, is that a big part of resilience is vulnerability and being willing to ask for help, being willing to tell people what you're going through, being willing to open up about your experience. Because I would hate for someone to think you just have to muscle through something without letting someone know you're having a hard time. I work with quite a few first responders,
Yes.
and one of the big pieces of first
I have
responder
to do it on my own.
care,
That's their culture,
right,
right? The
is
culture is often like, I can't show any vulnerability. I have to do this on my own. And it's
right,
yeah,
right. But the resilience piece for them and getting through
correct.
these really horrific situations is breaking that down and saying, "Hey guys, I'm going through a hard time. I'm in it, I'm doing it, and I'm going through it. Please be with me in
It's so
this."
interesting. The vets coming back from OIF, OEF, the Afghanistan vets in the last, whatever, 20 years, had substantially more PTSD than people coming back even from Vietnam and Korea and even World War
Wow.
II, which were objectively more physically dangerous. And one
Mhm.
of the issues that I've seen with the best explanation for why, aside from
Mhm.
time and generational and computers and all sorts of macro level issues, but the best psychological explanation I've had for why is because the OIF, OEF, the Afghanistan vets were told, when you come back, don't say anything.
Mm.
Now it's good not to tell details, right? Like you don't want to scare the neighbors or your spouse when you're coming back telling them gruesome details. Like that should be for therapy or for combat vets themselves. But to say I'm struggling right now because I'm thinking about what happened to me, I'm
Mhm.
going back in my mind to something that occurred, and it's very hard for me to be able to acknowledge I'm struggling, to be able to share the feelings was
Mhm.
something we told the vets not to do,
Mm.
Mm.
and it made
I can
such a
relate
mess.
to that in the sense from my own trauma. That was also the message I got from all sides, from my abuser, from
Mm.
those that were supposed to be my protectors, is don't tell. You're not allowed to say
Mm.
anything. Don't say anything. And that was a big piece for me as well. And what I would say from my part of resilience is it does teach you a lot more resilience when you live with like an anxiety disorder, but it's hard sometimes
Of
for
course,
those of our listeners that
of
do
course.
have it. I
Right.
remember a couple of times where I would tell my husband like I'm just tired. I don't want to do this anymore because it's not just the panic disorder, right? It's everything that crawls from it. It's the irritable bowel
Mm.
syndrome, it's the migraines, it's every effect it has on your body. And every day you get up and every day you're like, okay, I'm going to do my lifestyle changes. I'm going to meditate. I'm going to exercise. I'm going to eat healthy. And you keep it all together. But I also want a career and I want to be a great mom and but I need to understand what my limitations are and I need to keep it all in balance. It gets overwhelming sometimes. But I am also very grateful for what it has taught me so far because I do feel like it gives me this ability to be, if I listen, more in tune with my body because I have this huge alarm system that doesn't make any mistakes almost and
Right.
goes like, whoa, something is super out of order or out of balance. And if I listen, I get to identify that trigger and understand what I need to do to maybe circumvent the panic attack that may be coming. And for me, that all forms part of resilience, but it can be exhausting sometimes.
Mm.
Yeah, no one's minimizing the struggle. It's brutal. It's
No, of
just
course.
brutal, and you want to give up, and uh, yeah. from being in the
But then
clinic.
again, it feels so great that you didn't. Like today is not the day I gave
It is
up.
not that day.
Maybe tomorrow, but not today.
Well, and I can say I think you practice resilience, Dr. Jean, not just in your coping mechanisms, but I appreciate, being on a podcast with someone is a very intimate experience because we are not just together when we're with you, we're working as a team all the time. And I love that she is always willing to let me know or clue me in to when she's struggling or when she's having a day where she needs to unplug, or like she kind of preempts and puts that out there. And I think that's such an important part of resilience, which I think ties really nicely into this idea of the benefits that anxiety can present.
Mm.
Was it? Oh, there was a TED talk on like the power of anxiety. Was it McGonagall?
Yeah,
Someone did
stress. Kelly McGonigal. She talked about the
stress.
power of stress, and
Hmm.
which we've known for years. I mean, there are diminishing returns at a certain point, but up until that point, it's actually an increase in performance, in our ability to master certain things. I mean, there's a lot of benefits. You don't want to have zero stress.
Yeah.
Right. Hmm.
So maybe for those of our listeners who are still kind of unclear, am I just stressed or do I need to go seek help because I might have an anxiety disorder? I know we've said that it is when it really interferes with your daily life. But for those listening, what would you say are like the key things that would be red flags to you to say, okay, maybe you should investigate this a little bit more, go to your mental health care provider and see what this looks like?
Yeah, Dr. Kelly, I'm curious. You had some great things to say about this before, so
What
yeah.
would be my
What's your take
symptom?
on it?
So, I can actually reflect personally sometimes too on this, where I am, as a highly sensitive person and kind of a very heady person, kind of an intellect type person. I can definitely overthink. I can get into my own way sometimes with overthinking and feeling the anxious energy in my body. But what I notice for myself personally is that I have the ability to recognize when it's happening and stop and engage in skills or do things to mitigate it. As long as I have the space and the place to do that, I can work with it. For my clients, if they're presenting with the lack of conscientiousness of it, if it's happening like a flood, it's just happening without them being aware that it's
Awareness.
happening. Oh, yeah, the awareness piece is very important. I think also, um, if they are trying skills and they are trying all these different things and they're not getting any relief, that's usually a sign to me as well that there's
Sure.
something a little bit more clinical
Good
happening.
indication.
Right. So those are things separate from what we would read out of the DSM that are markers for me that this is not just I'm feeling anxious, but this is I am generalized in this, and or I am, specific in my phobia. I wouldn't necessarily diagnose that client of mine arachnophobic. She was
Right.
she was
Right.
okay.
Right.
Right? She was still sitting outside with the spiders. And it's funny because you said you would have people watch spiders first. I think in my mind, I intuitively knew she was already out there with them.
Right.
So the next step was getting to know them.
Understand.
But I think that would be from an experiential standpoint how I would know that maybe we need to look further into this. What about you and your
Yeah, I think
practice?
that all sounds really reasonable to me. I think either just small dimension I would add is the amount of time you're spending being anxious or dealing with
Mm,
it.
Good point.
In obsessive compulsive disorder, for example, one of the keys is it more than a half an hour a day? Because everyone, if you're just
Oh,
checking,
okay.
if people are checking the lock twice, that's not OCD. You're
mm.
checking, people check their phones. Well, that's a whole other story. That's more like an addiction. It's
We'll do a phone
a
addiction
separate
episode next.
conversation. Yeah. But, checking their lights, checking their locks, checking their health. If you're spending half an hour on WebMD on a regular
Mm,
basis, that's time to
mhm,
have a conversation with someone like, hey, maybe
Mm.
this is a little excessive. And half an hour is not a large threshold. And I I
mm-mm.
can't tell you how many times I've seen a patient and been like, I wish you came in 3 years earlier when it was only half an hour a day, and now it's 4 hours a day, and this is going to hurt a lot more for both of
Mm.
us. But I'm
Right.
all about prevention. I think that to me, it's crazy that people go visit the dentist twice a year for preventative mental.
I have a dentist appointment today, actually.
There you go.
Ironic.
Yeah. When's the last time you had a preventative mental health care visit?
Yeah.
Not often, but I love
Never.
that you
People
say
don't do
that because
that.
Yeah.
I feel like we should
Of
have
course.
family therapists, as in just someone you go to on a regular basis if something's happening, not just in a
Of course.
crisis.
I wished we did. I
Yeah.
mean, you know,
Mhm.
that's why every visit to the dentist isn't a cavity. It's a cleaning and an
Yeah.
examination
Mhm.
and a preventative x-ray or a pan. But I mean, mental health care visits, shouldn't it be at least twice a year?
Oh, yeah.
Mm.
Yeah.
Do you
It's
know
part of
there's
your body,
something
right? You look after your body, you look
Yes.
after your teeth, you look after your eyes. Of course, you have to look
Go to
after your
I go to an
mind.
optometrist, what, once a year?
Yeah.
What
Yeah.
else? General, PCP, if there's
Physical,
any.
yeah.
I have a physical. I have an annual physical once a year. And why wouldn't I have an annual mental health care well visit? That's where we
Hmm.
should be moving. I don't think it's only a matter of
Yeah.
putting out fires. That's not what it's about. By the way, and at that visit, they might recommend a book. They might recommend nothing.
Yeah.
They might recommend having more dates with your romantic partner, or going for a run, or eating a little more, eating a little less, or sleeping, or whatever it is. But like
Like a
basic,
tune-up.
a tune-up that which we need, which every human being needs. So
Yeah.
to me,
Right.
that's where we should be going.
And
I would love to, like, you seem as impassioned about this as I am because I would love to find a collection of professionals that we could be loud enough to get the people responsible for our laws to listen. Dr. Jean has
So
heard me say this before. There's something that I want us as a society, as an American government, to do. Other countries do this, we do not. On a yearly basis, we have our children go to a yearly physical before they go to school. Why are we not having a very simple mental status exam done at these visits so we can flag potential issues, let parents know, maybe even potentially prevent some of these horrific tragedies that are happening in our
okay, so
schools?
here's where there's some nuance, and I'll tell you some good news and also the qualification. You know what? I'm going to throw in the
Okay.
qualification first. I do not think
Okay.
busy PCPs or pediatricians should be doing a 2-minute wellness check, and that's going to suffice, because that's what happened last summer, where PCPs were the ones instructed to screen for zero anxiety, and benzos started, going up by. So
Mm,
simply throwing a
good
quickie
point.
2-minute intervention is not going to do. This is a
Okay.
conversation which is at least a half hour, probably more like an hour. It's at least a session, probably even more, frankly. But like minimally, it's an actual conversation, completing some measures with somebody who's trained in psychosocial ways of
Mm-hmm.
managing this, like a psychologist or a psychiatrist for that
Mm-hmm.
matter, social worker, mental health counselor. But we're talking about a professional. I wouldn't want my PCP doing dental cleaning or dental work on me in 10 seconds. I want to sit down in the chair, and I want the dentist who's a specialist and understands this to do preventive care with a hygienist, because this is what they do all day. So to me, that's the analogy. So that's my qualification. Do you want the positive news?
Well,
oh,
can I
yeah.
ask you a question about
Sure.
that? How do we mitigate the fact that people can't find therapists? There's a
So
shortage.
that, I think, has to do with the economy. And I don't mean,
Yeah.
what I mean is, what I meant actually is the economics. It's a matter of reimbursement rates. You know,
Mhm.
insurance companies pay for dental care, preventive care. It's zero. When I take my kids, or when I myself go to a preventive care visit,
Oh, good
I
point.
pay $0. That's covered by my
Right.
dental my dental insurance, because the American Dental Association lobbied, ferociously, to get this as part of the what gets covered. The APA, big P, little p, psychology, psychiatry, they are not doing that. But there
Yes.
was something
Okay,
positive
that's
which
a good
happened,
point.
which now I can tell you. So a
Yeah.
couple years ago, I wrote an op-ed for the Boston Globe, and
Mhm.
I wrote this idea: we need to have preventive mental health care. It got picked up by the Massachusetts Senate, and they
Okay.
actually passed a bill saying that insurers need to provide mental health preventive care, unanimously
Wonderful.
unanimously supported, unanimously
Wow.
supported by the Massachusetts Senate. Now, signed into law in the state of Massachusetts, not enforced, not at the federal level. So,
Mhm.
we all have, there's the legal parity, and then there's actually getting the insurers
Right.
to comply with these mandates and with these statutes. And that's going to take more than an act of Congress. It's going to
Mm.
take lawsuits and a lot more.
Right.
So
Right.
I think it'll happen. It's just a matter of who's going
Time
to
and
pay for it. And
politics.
we know the answer to that question in the United States, but it's got to
Mhm.
tick along. Couple
I
months.
would love if you could share that
Sure.
article with us so we could put it in the show
Yeah, that
notes,
would
and
be
I wanna
great.
read it and would love to keep in touch with you about
Sure.
this because this is something I'm so passionate
Yeah, I'm
about.
not such a policy, wonk. Like that's not my thing.
I'm not either, that's the problem.
Like, I was on a run one day. I was going for
I
a
have
run
ideas.
around the Charles River, and I'm like, this makes no sense. This is insane.
Right.
So I called up this editor I work with. He's like, yeah, you should write an article. Next thing I know, Boston Globe. It was just funny. So yeah, happy to share the article. And
Yeah, that would be great.
yeah,
And
it does have to change.
I just want to before we have to unfortunately let you go because we can talk about this
Uh,
for hours.
I know, we need, like, 3.0.
But just to bring it back to our listeners and maybe the patients on the other side where I was, right?
yeah,
Who are
Mhm.
terrified of being diagnosed. So I come from a long history of
Mm.
mental illness, and in my immediate family, it didn't turn out at all to be anxiety disorders, but still I was like, I do not want to be diagnosed with this. This cannot be me. And I may be wrong, but from my research, I have read that at least 99% of us are going to have a panic attack at least once in our lives. That's just going to happen.
90 plus in the United States. Not 99, not
Okay.
quite 99, but more 9 in 10 people will have a panic attack at one point. Now I've
Mhm.
had two.
I had
Okay.
one the
Oh,
night before I graduated college.
Okay. We're not going to say how many I've had. Like,
Yeah.
but what I'm trying to say is that just because you've had this panic attack, of course, yes, go seek help. You may
Mhm.
need help with chronic stress or just a difficult time in your life, but that does not necessarily mean that you're going to be diagnosed with an anxiety disorder. So you should not be afraid to go and seek
sure.
help for this, because it can be a completely normal experience to the current circumstances that you're facing. Is that fair to say?
Yeah, and if it is an anxiety disorder, don't you want to know?
Exactly. Well,
Mhm.
maybe
Touche.
you're too scared to know, but still, yeah, it would be better.
Yes,
It would
I don't
be
know. I
better to
prefer a
know.
cavity than a root canal, though.
That's true. If you look at it that way, that's true. I hope you're all listening.
All these dentist metaphors, I literally
Yeah.
have a dentist appointment in 2 hours. I'm hoping everything's okay in my mouth.
Well, yeah.
And then the last question I have to ask is we have been talking about this change in the DSM, the overdiagnosis sometimes. And I want to be very respectful because I have great respect for therapy. It's helped me so much on my journey.
Sure.
I really do believe that it's part and parcel of what needs to be part of your treatment plan. But if you are going into this for the first time, what do you need to be looking for in the doctor treating you or the therapist treating you to feel safe that you are not just being prescribed medicine rather than having other avenues
Yeah,
seen to, if that's a possibility?
great. Um, I have no problems with pharmacology if it's used responsibly. And what I mean by that is as follows. I kind of said this before. Um, if you look at anxiety or depression or panic or even substance abuse, anything, any behavioral health problem, let's talk about it on a scale of 1 to 10, okay? Or 0 to 10. 0 doesn't exist. We all have something. 10 doesn't exist. That's off the charts. So we're left with 1 through 9.
Mhm.
1, 2, 3
Mm.
are low. That's what everyone has. 4,
Mhm.
5, 6 are starting to become a problem in your life and interfere in some way. And 7, 8, 9
Mhm.
are causing significant, really significant impairment and distress. The goal of pharmacology to me is to get somebody down to a 3, 4, 5 ish.
Mm-hmm.
And then we need to learn the skills and learn the tools and use our anxiety or depression or proclivity for a addiction, whatever it is, in a positive, constructive way. If the goal of
Mhm.
pharmacology is to get you down to a 0, which doesn't exist, you lose. Even a 1, 2, or 3. Let's be realistic and get us to a functional, reasonable amount of distress, not to eliminate it. And the promise
Mhm.
of a distress-free life is
Mhm.
irresponsible pharmacology, in my opinion. It's an irresponsible way to prescribe. But if the goal is to get you to a level that you can actually manage it, that to me is in
Okay.
combination with psychosocial treatments, it's exactly what we need.
Mhm.
I love how you said that because that's one of the markers I usually my clients tend to work with me because they want to find other methods, holistic methods, self-regulation methods, but and it's almost like they feel like they've failed the holistic route if they have to go get
Definitely
medication.
not.
And I will remind them, listen, we've got all these skills, you know these skills, but because of your life circumstance or because of your biology or because of your medical issues or because of all these traumas, there's something inherently getting in your way of these coping skills doing what they can fully do for you. So why not get your body, your brain, your biology to a state where these coping skills can really work for you? And
Mm.
I think that resonates with what you're saying about that 4, 5, or 6. I love
Mm.
that. That's a really great way to describe that.
Thanks.
Yeah.
Yeah,
Mhm.
there are a lot of people who aren't on medication who should be because they're trying to fight against the 9 or 8 or a 7. Like, okay, I guess you could try, but like that's going to be really hard to scale that mountain if you're not prepared for the
Mhm.
altitude. Like, let's get some
Yeah.
oxygen, let's get you down to a reasonable level, and then you'll get your fitness up, and then we can talk about, the advanced class. But like, be humble, accept where you're at. Take the assistance, but don't. The goal is not to eliminate the struggle. So there's that balance, and I think
Right.
that that's something that
Right.
we're missing in the
Mhm.
education about this. So glad to be able to
Mhm.
chat about it here.
That is so helpful. And that helped me on my journey as well. I was angry at the medication, super angry at it.
Mm.
And my
Mm.
therapist told me more or less the same as you just said, Amelia. And that completely changed it for me. It changed my
Mhm.
perspective on how I see it. Thank you so much for your time today. This has been an incredible conversation. And I really hope we can have you back sometime because
Happy.
I think there's so much to
Definitely.
explore.
You're gonna have to rein us in though, because he and I kind of went on our little like
No, I love it.
therapy avenue, and just and you're like, okay, folks, let's get back to the questions.
No, I think our audience would have loved this episode. And I really just want to tell you guys listening, please go get Dr. Rosmarin's book, Thriving with Anxiety. It's such a refreshing look at anxiety, especially if you have been diagnosed with an anxiety disorder. It's really a wonderful read. And we're so glad you were here today. If anybody wants to reach out to you, know more about you, read your articles, where can they go to find you?
Yeah, my author's website, my last name, Rosmarin, ROSMARIN.com, or for clinical services, centerforanxiety.org, which has offices in Massachusetts, New York, and New Jersey.
That's wonderful.
Awesome.
Thank you so much for your time.
Thank you.
Yes, thanks for
Great
coming.
conversation. Thank you.
Bye. Thank you so much for listening to this episode of The Sensitivity Doctors. Please be sure to share our video clips on socials and ask your friends to rate and review this podcast.
Yes, sharing these videos makes it possible for your favorite podcast to move up on the ranks so that other people can find it, share it, and learn from it too. So if you can share today, we would really appreciate it.